Hello, Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'm going to be going over some of the latest sorts of data sources that are available to you at your disposal at various websites. And I'm not going to do this in the customary way that you browse through various websites and try to look for a data set. That's just too time consuming, honestly, and beyond the scope of this video. Um, this video is meant to be short but sweet. It's just meant to have the pertinent and most relevant points. So, in this, a group of 7 researchers got together and they published in the Journal of General Internal Medicine a comparison of national data sources to assess preventive care in the U.S. population. Um, Nearly half of U.S. deaths are attributable to preventable risk factors. So basically, you would add over 2 million healthy life years if you were to spend more effort into preventive care, if we were to spend more effort into preventive care. So let's start with the most well-known public health agency out there, the Centers for Disease Control. As it turns out, they have 6, not 1, not 2, but 6 nationally representative data sets, which you could be creating all sorts of original research questions out of. So, if we think about what's out there additionally, of course, there's the National Health Interview Survey. That's there. And the purpose of that is to monitor the health of the whole U.S. population by collecting and analyzing data on a whole host of topics. But just like that, just like the National Health Interview Survey, and I personally use this. Just the National Health and Nutrition Examination Survey is just a treasure trove of information to assess the health and nutritional status of adults and children in the United States. Now, don't let the word nutrition fool you by any stretch of the imagination. This data set has a lot more information than just nutrition. Additionally, of course, the Agency for Healthcare Research and Quality and higher educational institutions conduct at least 3 nationally representative surveys. So this was meant to be kind of a comparison. So the other ones were Medical Expenditure Panel Survey, MEPS. That's a longitudinal subset of households participating within the NHIS, which I talked about, the National Health Interview Survey. Another acronym this is a lot of acronyms, so bear with me here. United States Preventive Services Task Force, USPSTF, is actually has creates an advisory committee on immunization practices for adults ages greater than equal to 18 years of age. So all of these surveys, everything was searched. Additional one was behavioral risk factor surveillance system, looking at metropolitan, micropolitan areas. So here are all of the different data sets. There's also NAMCAS, National Ambulatory Medical Care Survey, and National Hospital Ambulatory Medical Care Survey. And these are for provision and use of ambulatory hospital services. And then for social sciences, you have the Health and Retirement Survey, a study, and then the PSID panel study of income dynamics. So right here, I mean, in just this one paragraph, what I loved about this part of this study is that just in this one paragraph, I was able to get so many. I didn't even tell you about the longitudinal study of aging, which is a cohort study of greater than aged greater than 70 years, which last collected data in 2000. So the comparison was made. You could look at these tables. Not going to go over too much of the detail, but you can take a look at basically this is like I'll look at this as a buffet of different data sets, and you can kind of pick and choose what areas you want to focus on, and then go accordingly. Now, there are certain limitations and certain types of variables that do exist in specific scenarios, and others that do not exist in other scenarios. So it's good to keep in mind what those are. But you can also look at what file organization maintains this, which is kind of interesting. Also, what type of study designs are possible. And so a lot of people say NHANES is actually is longitudinal, but actually it's cross-sectional. But you can link some of these. So with linked mortality, you can turn this into more of a longitudinal study. So there's some problems with oversampling, of course, which is something that is treated uniquely in various data sets, and that is shared with us. Major cardiovascular conditions, medical exam, and then this portion I thought was interesting. Was that prescription medications are actually verified by certain certain surveillance data sets. So, like in NHANES, one I use actually verifies the dosages as well. So this allows for a more accurate kind of reporting. In the medical exam, these are actual physical medical exams. So again, you have the option of going into the clinic yourself, putting on blood pressure cuffs of 90 patients over the course of a whole month, and collecting data and trying to determine a study. Or you can collect 90,000 patients in the click of a button, and download the information, and then try to determine with enough power. 90,000 would have enough power, adequate power, to make conclusions about what blood pressure is. So that is the difference. And that is the power of using secondary data sets, where there are very important measures like HbA1c, lipids, things that are so critical for preventive care. There's even includes 4 blood pressure measurements, pulse, weight, height, waist circumference. Some years there's certain things. There might be even a dental exam, hearing exam, vision exam, lung function, muscle strength, DEXA scan, you name it, it's there. And so there's even biomarkers starting. Actually, before this is not quite correct, but definitely beginning in 2006, included all of these, including cystatin C. This was not part of information before 2006, that I can confirm. So, what are some other sorts of unique features of these data sets that is good to know. I think the screenings, how they ask these questions. BRFSS is the best place to get information on this. I've actually presented in family medicine conferences repeatedly on the BRFSS and colon cancer. So looking at the different types of ways that screening can take place. So screening, even in and of itself, is not simple, because then you have to ask the question, what part of the screening and the screening algorithm is the person belonging in? So then you have osteoporosis, lifestyle questions, which are very important. Physical activity, healthy diet, weight, smoking, alcohol use. Actually, 5 of the surveys ask about sleep and 6 about sexual health. And believe it or not, I've actually analyzed a lot of these variables and presented them in either conferences, published papers, or have done both. Then there's weight, 18 topics, including self-reported weight history, attempts to lose weight, and then diet, exercise, medication, surgery. So this is most detailed in NHANES, but if you want more, the NHIS and BRFSS does have and contain information surrounding this. So then you have diet, you have 14 topics in diet, actually. So we should actually make a stop here. But every 5th year, the NHIS, and be on the lookout for this if you're a nutritionist, they ask a 26-item dietary screener, including food beverage consumption over the past month. And this is almost identical to NHANES. And there's some in MEPS. Physical activity, 16 topics. Tobacco, pretty self-explanatory. Alcohol, sleep. Sexual health is actually one that there's 47 topics in NHANES. And so it has a very detailed, surprisingly detailed section on sexual health. And BRFSS, NHIS, only about 2 to 3 topics. So NAMCAS, just talking about HIV, hepatitis B or C. Mental health, very important. PHQ-9 is the go-to for NHANES and BRFSS. HRS MEPS goes on a more simple depression symptom screener during the past 12 months or 4 weeks. And that just about does it. The next section is about just how it's packaged and transferred. I want you to be aware of this being packaged in all types of software code. So typically data are downloadable in SAS transport or comma delimited formats. So what you do is you have to take all of that and kind of convert. Stata and R. Stata is not free, neither is SPSS, but your university may have some sort of subscription to them. So SAS has a free version, which you can use, and R is completely free. So R, and I have built R commands. I actually have it placed in my channel. But SAS transport data can be read through R. The NHANES 8 package I highly recommend. I've built some programs on this. And then for some researchers, statistical briefs are kind of neat to go through. But just go through this article very thoroughly. It has a lot of good, not only resources, but it has good work that has been provided here. I'm familiar personally with some of these names and individuals whom I have worked with over the years. So yeah, it's a really good paper. And so just go through all of these instructions and see if you get some good information. The sample weights it might be a good resource. I have some good sample weights resources as well in my channel. So go through these, and I hope you've learned something about secondary data analysis in comparison to primary data and how easy it is to access these 6 data sets that I focused on today. Thank you for listening.